So Discovery was a prospective cohort study in which clinicians, mainly in the United States, but several other countries were included, who were caring for patients in which they might suspect cardiac amyloidosis, particularly cardiologists who were caring for patients with, if you will, heart failure with a preserved EF or diastolic dysfunction, were offered free genetic testing in order to sequence the TTR gene. There was also a minimum amount of additional data that was clinically obtained, including the age of the patient, some biomarkers, echocardiographic features, and so forth. So it was a pretty simple and straightforward cohort study. Was conducted in several hundred people, in which basically we determined that mainly in the United States population, the prevalence of the allele, no surprise, was about 4% in those who were 35 years of age with clinical heart failure and who are African American, and that's because that's the population prevalence of the mutation. But in individuals who were older, particularly over the age of 75, who had heart failure, a preserved EF, low voltage, the prevalence of the mutation was and an increased wall thickness, it should say. So it was older adults, African American, who have a discordance between their wall thickness and their voltage. The prevalence of the V122I mutation was 40%, which is astronomical. That means that in unselected individuals who are particularly of advanced age and have the ancestry that would suspect TTR amyloid, that genetic testing has a much higher yield than we ever previously thought.